Hi guys, Dr. Shamji here, just checking in with everyone, hoping everyone is staying safe, following, all the government guidelines, enjoying their time with family. Hopefully, we're near the end of all this and we'll all be able to go back to some sort of normal life, go back to work, go back to seeing our patients. But just here to check in, letting everyone know that we are still here for you. We're taking your calls, we're taking your emails. We're just a message away, whether you're our patient or not. Know that we're here for you guys in this time. So if you need us, we're out there. Feel free to reach out. I did want to share a story with everyone about something that is very applicable, I think, right now, and actually happened to myself and my wife earlier today. And that's our little 3-year-old was running around with a step stool, and we told him not to do it, but obviously it's really tough. These kids are running around the house. It's really tough to keep them entertained, and they take dives, they take falls, things happen. And he happened to land right on the step stool, and he gashed open the side of his cheek and bit the inside of his mouth. And as you can imagine, it's a scary scene. I'll be honest, there was a lot of blood everywhere. And for someone like me, I'm in this scenario regularly, but it's scary. You don't know what to do and you sort of panic in that moment. But the first thing you want to do is obviously stay calm. Your kid's going to be crying. Everyone's going to be really worried. The first thing we did was we picked him up, we took him to the sink, asked them to keep spitting out all the blood that was in there, tried to keep him calm. We got ice packs, water, and we were basically putting pressure on the wound outside there to try and stop the bleeding. Right now, no one's doctors are open, dentists are closed. These things happen at home, and a lot of people in that moment, it's tough. Some people may just rush to the hospital, and that's okay. You don't know how bad it is. But normally with these kids, especially an injury in the mouth, it always looks a little bit worse, especially with the bleeding. When kids bite their lips or their tongues or their cheek, there's a lot of blood flow to those areas and it bleeds a lot, but it also heals pretty quickly. After about 30 seconds of asking our son to spit out all of the, blood in his mouth, and we saw the wound inside his cheek and the teeth looked fine. And the cut on the outside was pretty bad, but we just maintained pressure there. And we kept him calm and we got some ice on there. We gave him a little freezy to suck on. And after 3 or 4 minutes, the gash looked bad, but this kid wasn't bleeding anymore. He didn't seem like he was in pain. He was running around again. And in that 4 or 5 minutes, yeah, we were a little bit panicked, but it helped that we stayed calm and got him through it. We didn't immediately have to rush out to the hospital, or worry about anything like that. But in those situations, it's tough, right? I'm a dentist, and luckily I had some other tools like gauze at home. I had sutures if I needed them. Thank God I didn't. But it's scary, and these kids, it happens all the time. So I just wanted to share what happened to us today, what's happening probably to a lot of people out there regularly, and just stay calm again with these injuries with the mouth. It always looks a little bit worse. Make sure their teeth aren't loose. Kids will tell you if it's bothering them after, they'll point to it, they'll let you know. But they also are extremely resilient. They heal up extremely quickly. And, ice cream, it always helps. So, just a tip I wanted to share with you guys. Other than that, stay safe, keep in touch. Again, practice good oral hygiene. Flossing's a must right now, and hopefully, we'll see you all soon. Okay, take care.